Hello, I'm Julia George, and this is the Sunday Politics in the South East. Should more of us be looking after our loved ones at home? Kent County Council plans to cut the cost of adult social care, especially care homes, which cost £162 million a year. It's clear they want more of us to be looked after in our own homes. Old people in Kent are being promised a better service for less money. Is that really possible? Helen Drew has our report.
Keen artist Patty could have stayed in her house, but she opted to live here in a Tunbridge Wells care home. She's 99 years old and enjoys being looked after.
I love this special place for drawing. It's lovely. I can do this all day and not having to get meals is lovely. Just go up there and your meal's ready for you. It's absolute bliss. And it's nice to have company when you want it, you know. I go up and sit in the sitting room with the others.
But Kent County Council is changing its approach to adult social care with what it's calling a transformation programme. And as part of that, residential care homes could become scarce.
Kent County Council needs to make £200 million of budget cuts by 2015. One of the key areas it's targeting is adult social care spending. And at the moment, a large proportion of that spending goes on care homes.
The council spends £352 million a year on adult social care, and of that, nearly half is spent on residential and nursing care at £162 million. The plans outline a shift from residential care with paid staff to encouraging people to stay in their homes, cared for by unpaid friends and family.
The way that it would appear is to definitely keep people out in the communities, being looked after by families and carers as much as possible. So relying on the local community and families, I think, more and more, putting more pressure on families. There are a lot of people that need to come into care because they're lonely, and because of the demographics of how we live, families are not always living close by, so they go days without seeing somebody.
The council says that encouraging people to stay in their homes will preserve independence. Ron Edwards looks after his wife Betty, who has dementia. He's her full-time carer, and this is how he spends his day.
I can't hardly leave the room without her calling out and saying, "Don't go out, please, don't go out." So I'm really sitting here, as you see now, and she's sitting there looking at me as she is now. And that's how she spends her day, looking at me.
The couple get regular visits from care workers like Mandy, who works for a charitable organisation.
Right, Bet. Got a nice bit of cake here.
Ron says having help is essential.
You've got to. I mean, you've got the help from my next door neighbour is important. The charitable organisations are important. I couldn't do without them. And there's one in particular in Maidstone I couldn't do without at all. And without those, I don't know how one would manage.
In order for people to stay in their homes, there might need to be many more carers like Mandy to provide support. Some say there'll be no option but to use agency staff, who come at a premium and therefore might actually cost more.
The care agencies will charge a fee, and we have come across occasions where we're paying the agency twice what the cost is to the to the individual client. So in a sense that's dead money. It's one of the worries that we have about the whole transformation process, that we don't know either whether the capacity for care workers is there or whether the savings will actually be achieved. We had a parallel when the government broke up the mental hospitals and provided for people to be living at home. It was thought that that would be a cheaper option. In fact, it turned out to be a more expensive one.
The over 65s population is steadily increasing, and how Kent County Council treats those who need care is going to become more important than ever. But is moving away from care homes and placing more responsibility on adults and their families the right approach?
Helen Drew with our report. Well, joining us now from our Westminster studio is Graham Gibbons. Graham is the Cabinet Member for Adult Social Care in Kent. Thank you for being with us, Graham Gibbons. It sounds like there's a shift then in responsibility from you as a county council to us, to individuals, to look after their loved ones in their own homes more, like Ron does.
The issue is, Julia, that we're looking forward over the next 20 to 30 years. The number of people over 65 is going to increase by about 55%. And this does mean we need to look and focus on how are we going to care and support this increasing number of people. There is no intention that residential care homes will cease. What we're looking at here is how can we support people to remain independent for as long as possible. Over the last few years, the one consistent theme that people have said to me is, Graham, we would like to stay independent with our own front door for as long as possible. And this means, of course, providing the right support to those people.
Well,
the big focus should be on...
Graham, that's absolutely crucial, is the support, isn't it? I appreciate what you're saying. I'm sure there's lots of people sitting at home saying, I would rather be at home than in a care home. But people, those carers need help. Ron Duck can't even leave the room without his wife missing him. And I've spoken to carers who are suicidal, carers who have become reliant on alcohol. People who have in their 40s looking after their elderly mums have no life of their own. I spoke to a man whose vulnerable mum lived alone at home. She had 15-minute visits every day from carers. When he went to visit her, he found that she had been weeing in the plant pots and she was screaming for help in the porch. The carers and these individuals need to know that you are going to look after them if there aren't going to be places in care homes for them.
Well, Julia, I'm not saying there will not be places in care homes. What I want to stress, though, is that we need to be looking at how do we support carers more carefully and more strongly. And I want to place now on record my very real debt of gratitude. We all have a great debt of gratitude to the carers who care for other people in our community. And they do a brilliant job. And what we need to be doing is thinking about how do we support people to care for people more? How do we ensure that carers stay healthy?
Don't ask the questions, answer them, Graham.
No. We need to be putting in place measures to ensure that the right sort of care is provided that enable carers to go on having their own activities, that carers can stay healthy.
Well, let me give you an example of where the problems come from.
Julia,
volunteers. You talk in your report. Yeah. I've read your report from cover to cover several times. You talk about volunteers, presumably charities like the Crossroads Care with branches in East Kent and West Kent and Medway. They offer respite care for carers. They just say that their funding is at risk from the beginning of the next financial year.
What I would say to all voluntary organisations is that I actually firmly believe that coming out of this transformation programme, we will actually be using and supporting and funding volunteer organisations a lot more than we do now, because I really understand and appreciate the great contribution the voluntary sector has to make.
But how can you rely on them more when they don't even know if they've got enough money to survive into the next financial year?
This is why we're doing this transformation project, Julia. We need to be looking at all the things that we do, all the services we provide, and how can we do them more effectively? How can we work more closely with health colleagues to ensure that we don't have duplication of services and that we can do exactly what you're saying and supporting the voluntary sector, supporting carers. The voluntary sector really can play a big part here in helping carers to do the job. I want to do that and make it happen.
Sorry to interrupt. How much do you plan to save from your budget?
I cannot say how much we plan to save. We are being really responsible here by saying we're going to look at all the services that we provide, and we are going to look at them all and see how can we do them more efficiently. And that does mean, of course, looking at working with health colleagues. How can we ensure that we are really making care for people taking place in their communities? How can we be working with the emerging clinical commissioning groups, with GPs, to ensure that we are actually making sure that people are being provided with services in their community where they need to be served and supported?
I'd like to bring our guest of the day in. Graham, thank you very much indeed for being with us in our Westminster studio. Greg Barker, could you do what Ron Edwards does, that chap we saw in our film?
Every time I see a carer like Ron, I know, it's extraordinary what they go through, and who knows which of us would really be up to that job, and it's a roll of the dice, isn't it? Who that's going to be. It could happen to any of us, and hopefully it won't. I had my aunt, one of my closest family members, was heroic the way that she looked after my uncle for many years with a very debilitating illness. For many, many years at home until he finally had to go into full-time residential care. But many of us are actually growing older and being healthier for longer. And it was wonderful to see Patty there in 99, drawing and having a lovely quality of life.
Loving her care home.
Loving her care home. But I think most people, if they're fit and healthy, certainly speaking from my point of view, I want to put off to the very last minute, the point when I go into a care home. And the idea that happiness is a council-run care home in your old age, I think is from another era. People want support, they want choice, and it's about putting people first and really putting people at the heart of these policies, not a doctrinaire commitment to council-owned facilities, but actually saying what's right for people, be they carers or those who are being cared for.
It is, Paul Clark, it is going to be hard, isn't it, to save money and offer a better service. Is it even possible?
Well, I mean, there's always room for improvement in spending of any budget, whatever stage you're at. So I recognise that. But I have to say, with the increasing number of people that are going to be, 65 and beyond, we're living healthier lives and so on. But there will be demands, and Patty,
this is going to be
critical
the increasing population. This is the cost of elderly social care across the country is going to be a bigger issue than the financial crisis we've just had.
The two aren't unrelated, are they? You can only afford what you can afford, and you've got to get the very best value for money from it.
Yeah, £350 million is spent by Kent County Council on adult social care. 90% of that is already outsourced to volunteers in the private sector. It does ask the question whether you can get more out of that given pound. There will be some, I'm sure, improvement possible, but it won't be to meet the requirements that are needed.
We will find out, Graham Gibbons. The next stage of the transformation is in a few months' time, and I'm sure Graham can put the flesh on the bones a bit more of how much the savings will be by then.